A stroke comes suddenly.
A person can be sitting at home and just relaxing.
Everything seems just calm, doesn't it? And suddenly become unable to speak or experience severe weakness on one side of the body or even a severe headache. And by this time it is too late, and the stroke comes to that person. But did you know that there are symptoms that can detect a stroke up to a month before it occurs and prevent it?
In 2021, stroke accounted for 12% of the death rate, and this is a high number.
In this video, we show the signs that if you experience any of them, you should see a doctor as soon as possible because it can be a sign of a stroke is happening. Well, none of us want this to happen to us or those around us, and you should know that stroke is not limited to the elderly and includes the suffering of all ages. The number of strokes has been increasing in recent years, but don't worry, by watching this video, you can identify the symptoms a month before they occur and save yourself and others.
Increased blood pressure. When chronic hypertension is discussed in relation to stroke risk, it becomes clear how dangerous it may be and how much it can raise the chance of a stroke if left unchecked. Blood pressure is a measurement of the force that blood exerts on the walls of our arteries. When this pressure rises, it is referred to as hypertension, and it can have serious health consequences. Over time, this increased pressure may weaken, burst, or constrict the blood arteries as a result of damage to them, all of which considerably raise the risk of stroke in the event that a blood vessel in the brain bursts from elevated blood pressure, potentially leading to hemorrhagic stroke. Similarly, if high blood pressure damages the arteries that supply blood to the brain, it can reduce blood flow or cause an obstruction that results in an ischemic stroke. Adopting a healthier lifestyle and following prescribed medication regimens to control blood pressure are essential steps in reducing the risk of stroke and other cardiovascular diseases. Excessive fatigue. Excessive fatigue or acute fatigue may indicate a stroke. It is important to remember that there are other causes of fatigue. If you feel tired all the time, it may be for other reasons. But if you are getting enough sleep and rest and still feel tired, it may be a concern. This extreme fatigue can be caused by changes in blood flow to the brain. This could be the result of a narrowing of the artery caused by atherosclerosis or a potential clot that is preventing oxygen from reaching the brain. Therefore, if you're experiencing unusually high levels of exhaustion, get checked out by a doctor. Occasionally, severe fatigue may occur before a transient ischemic attack, which is a temporary disruption in the blood flow to the brain. A transient ischemic attack serves as a crucial alert and may be a sign of an imminent stroke. The symptoms usually subside within a few minutes to several hours and do not result in long-term brain damage. Patients often experience symptoms similar to a stroke, but within less than 24 hours, the symptoms completely go away. This usually happens when an artery in the brain becomes temporarily blocked. Within that time, the body effectively dissolves the brain clot thrombus, causing the symptoms to disappear. This quick recovery acts as an important alert that a stroke might be imminent. Keep a tight eye on these people, and if you observe any fleeting symptoms, you must seek medical assistance right away. Vision problems. Any abrupt changes in your vision could be a warning indication of stroke. Double vision, blurred vision, or trouble focusing can be indicators of brain circulation impairment and stroke warning signals. While visual issues can have a variety of origins, it's critical to pay attention to these symptoms. The most frequent type of stroke, an ischemic stroke, can cause vision loss due to blockage of an artery supplying blood to the eye. Therefore, it's critical to take these changes seriously and get medical attention as soon as possible. Sudden and severe headache. A sudden and severe headache can precede a stroke. It is important to note that not all headaches are related to a stroke,
And not all strokes are accompanied by a pre-stroke headache. Headaches are caused by a blockage of blood flow to the brain. These pains when they occur are described as severe and sudden in a hemorrhagic stroke, which is characterized by bleeding inside the brain. Severe headaches are caused by increased intracranial pressure due to bleeding. Severe pain and loss of consciousness. This reaction is especially common in hemorrhagic strokes, where the headache experienced is often described as the most severe in a person's life. Sometimes a severe headache can indicate an imminent risk of rupture of an aneurysm in the brain.
Loss of body balance. A sudden loss of balance and coordination can indicate a stroke.
These problems include dizziness, inability to ambulate, inability to make precise movements, ataxia, or uncontrollable movements, and falls.
And a feeling of heaviness in the head may occur.
These risks usually occur due to reduced blood supply to the brain or damage to other areas responsible for processing and coordination.
If you experience these symptoms, see your doctor immediately.
The last one, which is very common and often precedes a stroke, is weakness or numbness in the face, arms, or legs. When a person suddenly notices weakness or numbness on one side of their face, they may have problems with facial muscles such as drooping on one side of the face, difficulty smiling or closing their eyes. This weakness is caused by damage to the brain areas that are responsible for controlling facial muscles. Also, weakness or numbness in one of the arms, especially if it occurs suddenly and on one side of the body, can be a sign of a stroke. This condition may cause the person to not be able to move their arm properly and feel heavy or weak in it. The cause of these symptoms is damage to the brain areas responsible for controlling hand and arm movements. Weakness or numbness in one or both legs can also be due to problems with blood supply to the brain and damage to the areas responsible for controlling leg movement. This type of weakness may cause problems with standing, walking, or maintaining balance. If a stroke damages the areas of the brain that are responsible for controlling the movement of the legs, the person may also suffer from coordination and balance disorders. These symptoms can come on suddenly and range in severity from mild to severe. If these symptoms occur temporarily and then disappear, they may indicate a transient ischemic attack.
All the symptoms we mentioned can appear up to a month before a stroke and inform you.
And if I shorten the symptoms for you, they would be increased blood pressure, excessive fatigue, vision problems, sudden and severe headache, loss of body balance, weakness in the face, arms, or legs.
Don't forget to like and subscribe, and I hope you be healthy until next video. Your health friend. Health Delight.